Hi everyone, my name is Lindsay Bastian and I'm a third year environmental engineering and global health student here at Arizona State University. And studying those two fields, I'm super interested in how public and environmental health are interrelated. So tonight we're going to be talking about a subsection under public health and sexual health, which is HIV treatment. This topic is really important to me because I think, especially as college students, it's important that we all are educated on our sexual health. So I want to thank you all for spending your time tonight listening to this talk about HIV treatment. If at any point you have any questions, please feel free to unmute yourself or type it in the chat and I will get to it. And yeah, I just wanted to say thank you again. I really want to make sure that everybody feels comfortable in this conversation. So I want to assure you all that anything that is shared during the session will remain confidential with me. And I also want to point out that I do realize I'm a woman giving a talk to a group of college men, but I do think that there is a lot of valuable information in this talk that can help you protect yourself and your partners from HIV. So something that I think is really important to point out when we talk about HIV treatment is that there isn't a cure anywhere in the world for HIV, but there are life-saving treatments available. And the only way to get access to those, if needed, is to know your status. And the only way to know your status is to get tested. And then another important aspect of treatment is that treatment allows for an HIV positive person to lower their viral load, and therefore they become undetectable, which means that they can't transmit the virus to anyone else. So clearly, HIV treatment is super important, and I'm really excited to give this talk tonight with you all. So can anybody tell me what an ARV stands for? That's okay, it's a hard one. ARVs actually stand for antiretrovirals. So these are medications that are taken by HIV positive people to lower the viral load or the amount of the virus present in the body. So when an HIV positive person gets on ARVs, their viral load is suppressed and HIV cannot replicate. But the only way for somebody to get access to antiretrovirals is to get tested and know your status. So, like I said, get tested, know your status, get access to this treatment if needed, and break the cycle of HIV transmission. So I do want to point out that ARVs are a medication that is taken once a day at the same time, very similar to birth control. And these medications, like I said, suppress the amount of virus in the body. Somebody who tests positive for HIV should take ARVs as soon as possible. And I do also want to point out that there are some side effects reported with these medications, but if a person is experiencing side effects, then that would be a conversation they would have with their physician. And I do want to point out that there are so many positive effects that really outweigh the side effects. Like I said, these medications make it possible for an HIV positive person to live a long, healthy life and make the virus untransmittable, which is super important. So when taking this medication, adherence is really, really crucial. So that means that the person who is taking the medication needs to be taking it every day at the same time without missing any doses. And that is super important because, like I said, these medications lower the amount of virus in the body or the viral load by suppressing it, which means that replication cannot occur. So like I said, get tested, know your status, get access to these life-saving treatments if needed, and break the cycle of HIV transmission. So Now that we know what ARVs are and who should take them, like I said, that the ARVs lower the amount of virus in the body, making it untransmittable. So once the viral load is lowered to an undetectable level, the virus is no longer transmittable. So that the HIV positive person can't transmit the virus to an HIV negative person, which is why treatment is so important on both sides of the spectrum for the HIV positive person and for the HIV negative person. So when we talk about ARVs, I also think it's really important to go over ARVs that are taken by HIV negative people. So there are two of them, PEP and PrEP. PEP is called post-exposure prophylaxis, and it's a medication that is taken within 72 hours of possible exposure to HIV. And it's taken for 28 days twice a day, and it greatly reduces the risk of transmission. And then PrEP is called pre-exposure prophylaxis, and this is a medication that is also taken daily by an HIV negative person who is at a higher risk of HIV transmission. So I hope that this information is useful for you all and that you can take something away from this. So like I said, remember, get tested, know your status, get access to these life-saving treatments if needed, and break the cycle of HIV transmission. So thank you all for spending your night listening to this talk about HIV treatment, and I hope you have a good rest of your night.